Let's take a deeper look at Polycystic Ovary Syndrome, or PCOS, using the simple mnemonic CHAOS, because when this condition develops, the hormones in the body truly go into chaos. C stands for cysts in the ovaries. In PCOS, the normal ovulation cycle is disrupted because of high insulin levels and increased androgens. The ovarian follicles stop maturing halfway. Instead of releasing an egg, they remain inside the ovary as small, fluid-filled sacs. Over time, these immature follicles line up like a string of pearls, which is exactly what we see on an ultrasound. These cysts are not dangerous on their own, but they reflect a much deeper hormonal imbalance. H stands for hyperandrogenism, excess male hormones. In PCOS, the ovaries, and sometimes even the adrenal glands, start producing too much androgen. When these hormones rise, they create visible physical changes: facial hair growth on the chin or upper lip, chest or abdominal hair, persistent acne, and even thinning hair on the scalp in a male pattern style. These symptoms can affect confidence, but more importantly, they signal how disrupted the hormonal environment is. A is for anovulation, when ovulation doesn't happen regularly or stops completely. Normally, one egg matures and is released each month, but in PCOS, hormonal imbalance interrupts this process. Without regular ovulation, menstrual cycles become unpredictable. Periods may come only a few times a year or may stop entirely. And because no egg is released, many women experience difficulty getting pregnant. One of the hallmark signs of PCOS is anovulation. O stands for obesity, especially central obesity. PCOS is tightly linked with insulin resistance, meaning the body doesn't respond properly to insulin. This causes sugar to stay in the blood and fat to accumulate, especially around the abdomen. As abdominal fat increases, insulin resistance worsens, and rising insulin levels trigger the ovaries to make even more androgens. It becomes a cycle. Insulin increases androgens, and androgens worsen. The symptoms: S stands for skin changes. High insulin and high androgen levels can lead to multiple skin issues: acne, oily skin, excess facial and body hair, and acanthosis nigricans, those dark velvety patches around the neck, armpits, or groin. These patches are one of the clearest visual signs of insulin resistance.